Hello friends, welcome to Shankar IAS Academy Daily Newspaper Analysis. Today's date is 9/7/2024. Displayed here are the list of articles that we are about to discuss today. So without much delay, let's get started. Look at this article. It talks about the high out-of-pocket expenditure on health for the citizens of India. The main reason behind this is the low public health spending in India. This is the crux of this article given here. Let us understand some of the important points given in this article from our main answer writing discussion. Let me read out the questions for you. Access to affordable, quality healthcare is still a dream in many pockets of India. Discuss. This question can be asked in UPSC mains in GS paper 2. The only keyword in this question is discuss. See, when discuss is given in your question, it should be noted that you have to give various perspectives of that matter. So in the first part, you have to write about the reasons for the inaccessibility to the quality healthcare services in India. And in the second part, you can suggest some measures to overcome these challenges. This is how we are going to address this particular question. Now, starting with the introduction, you can write as follows. With a large and a diversified population, India faces persistent obstacles to health equity, including notable differences in the healthcare outcomes and access. According to the Lancet Medical Journal Global Burden of Disease Study, India ranks 145th among the 195 countries surveyed. This means that even though access to healthcare has been improved over the past 20 years, there is still much work to be done in both rural and urban areas. Some of the issues that reasons for inaccessibility to the quality healthcare services in India are as follows. This is the way you can move on to the first part of the answer. Here you can write that. Firstly, low healthcare spending in India. India's public healthcare spending is around 1.35% of GDP, far below the recommended 2.5%. This leads to inadequate infrastructure, shortage of medical professionals, and insufficient resources in the public healthcare facilities. According to the National Health Profile, India has only 0.9 beds per 1,000 population, and out of which only 30% are in rural areas. Secondly, high out-of-pocket spending. See, India has a shortage of hospitals, particularly in rural areas, and many existing healthcare facilities lack basic equipments and resources. An estimated 60 to 80 million households have fallen below poverty line due to medical expenses. Thirdly, the geographical disparities. There is a stark contrast in the healthcare access and quality between the urban and rural areas. Rural areas often lack basic healthcare facilities, qualified medical personnel, and essential medicine, forcing the residents to travel for a long distance for treatment. Fourthly, quality of the care. Even where health services are available, the quality of the care can be substandard. This includes outdated medical equipments, poorly maintained facilities, and inadequate training for the healthcare workers. Then there are underdeveloped states. See, the states like Bihar, Uttar Pradesh, Madhya Pradesh, Odisha, and Assam lag behind in terms of healthcare infrastructure and services. These states require targeted interventions to bridge the gap with more developed regions. Then, the rise in the non-communicable diseases like diabetes, hypertension, and cancer requires a shift from episodic to the continuous care. The current healthcare system is not adequately equipped to handle the long-term management of non-communicable disease, that is NCDs. Finally, there is a gap in doctor-to-patient ratio. One of the most critical concerns is the gap in the doctor-to-patient ratio. According to the Indian Journal of Public Health Care in India, India needs about 20 lakh doctors by 2030. However, currently a doctor in the government hospital attends about 11,000 patients, which is far more than what WHO has recommended, that is 1:1,000. You can write these points in the first part of your body. Now moving on to the second part, here you can write that. Firstly, there is a need for investing in the construction of new healthcare facilities and upgrading the existing ones, as well as increasing the funding for healthcare services and medical research. Also, there is a need for increasing the number of healthcare workers. It includes increasing the number of medical schools and training programs, as well as offering financial incentives to encourage healthcare professionals to work in underserved areas. Secondly, there is a need for time-bound implementation of targeted programs to increase access to the healthcare services for the people living in poverty, mainly for the lower caste and especially women, as well as providing education and information about the healthcare services to these communities. There is also a need for enforcing regulation, implementing quality control measures, increasing transparency, and conducting audits of healthcare programs. Thirdly, we should address the root cause of health inequality. For this, the healthcare system should be work in coordination with other sectors such as education, housing, and sanitation to address the social determinants of health and reduce the overall health inequalities. Fourthly, investing in R&D, that is research and development. By additional tax deduction to further support greater investment in new drug developments and reducing GST on the life-saving and essential drugs is necessary. Finally, there is a need to recognize that health of the people is closely connected to health of animals and our shared environment, and collective health initiatives covering healthy atmosphere, healthy animals and healthy humans are the need of the hour. You can write these points in the second part of the answer. Now, moving on to the conclusion part. For India to achieve its aspiration of becoming a developed country by 2047, we need to innovative technology solutions for India's healthcare requirements and the government's increased focus on healthcare sector. The next few years are important to tackle its long-standing healthcare issues and at the same time adapt to meet the ever-evolving healthcare needs of its citizens. That's all about this topic. With this, let's move on to the next topic for the discussion. Look at this article. Recently, Economic Offences Wing of Chhattisgarh has registered FIR against 2 IAS officers and the state officials in a coal levy scam. With this background, we are going to discuss the basics about coal, its types and other features, and also about rat hole mining from Prelims point of view. First, we will see some basics about coal. Coal is a fossil fuel formed from the fossils of plants and animals, buried under the soil for millions of years under great pressure and temperature. On the basis of depth, the carbon content of the coal can be classified into 4 types. They are peat, lignite, bituminous and anthracite. Among these 4, peat is the least quality while anthracite is the highest quality because it has high carbon content and high calorific value. Here note that calorific value is the amount of energy that can be produced from a unit of coal. At present, coal accounts of about 55% of the energy production of the country. Moving forward, we are going to see major locations related to coal production. According to Ministry of Coal, the major coal producing states in India are Odisha, Jharkhand, Chhattisgarh, Madhya Pradesh, Telangana, Maharashtra and West Bengal. Among these states, Jharkhand has the largest coal reserves that accounts about 83.15 billion tons. In the world, China is the largest coal producer. Let's now see about rat hole mining. See, it refers to extraction of coal from narrow and horizontal seams. The practice of rat hole mining is highly prevalent in northeast India because in the hilly region the coal seams are thin and therefore building a huge coal mine will not be profitable. In 2014, the National Green Tribunal banned the rat hole mining, citing that it is dangerous to the miners and also cause several environmental problems. So with this article, we have covered about basics of coal in a holistic manner. With this, we have come to the end of this article. Let us now move on to discuss about HPV vaccine in our next discussion. This article talks about the vaccine for human papilloma virus and its impacts on the public health. So first, we shall know about what is HPV and then we shall see about the HPV vaccine. Know that the cervical cancer develops in a woman's cervix. The cervix is the entrance of the uterus from vagina. Almost all the cervical cancer cases, that is almost 99% of the cases, are linked to the infection with the high-risk human papilloma virus, that is HPV. Know that HPV is a common sexually transmitted infection. Almost all sexually active people will be infected at some point of time in their life with HPV virus, usually without symptoms. Our body's immune system fights off the HPV most of the time, but if they persist for a long period of time, they lead to the development of cervical cancer. HPV is a necessary cause of cervical cancer, but it is not sufficient cause. This means other cofactors are necessary for the progression from a cervical HPV infection to a cancer. For example, long-term use of hormonal contraceptives, high parity, that is, parity is the number of pregnancies a female has carried in the past 20 weeks, early initiation of sexual activity, multiple sex partners, tobacco smoking, and co-infection with HIV are identified as established cofactors. These cofactors along with HPV infection can lead to HPV-caused cervical cancer. Moving forward, let us see about some symptoms. As I said earlier, early stage of cervical cancer generally produces no signs or symptoms. Signs and symptoms of more advanced cervical cancer include vaginal bleeding, watery or bloody vaginal discharge, pelvic pain or pain during intercourse. Now, talking about the cure for the disease, see, we are very concerned about cervical cancer because cervical cancer is the 4th most common cancer in women globally. In India, cervical cancer is the 2nd most common cancer in women. India contributes the largest share of global cervical cancer burden. According to a study published in The Lancet, India accounted for nearly 1 in every 4 deaths globally due to cervical cancer. Surprisingly, the cervical cancer is preventable and treatable if detected early. You can reduce your risk of developing cervical cancer by having screening tests and receiving a vaccine that protects against HPV infection. Servavac is the India's first indigenously developed HPV vaccine. The vaccine is based on VLP, that is virus-like particles, similar to hepatitis B vaccination, and it gives protection by producing antibodies against HPV virus L1 protein. See, these VLP have the same outer L1 protein coat as HPV, but they do not contain any genetic material. The vaccine uses these VLP as an antigen to induce a strong protective immune response. If an exposure occurs, the vaccinated person's antibodies against L1 protein will coat the virus and prevent it from releasing its genetic material. This is actually how the vaccine works. Remember, the vaccine should be given in 2 dosages for those in 19 to 14 years old and 3 dosages for those in 15 to 26 years old. So that's all about this article. With this, let us move on to our next topic for our discussion. Look at this article. It is about the serial killing in Noida. Recently, the Supreme Court agreed to hear the plea from CBI. With this background, we shall begin with the discussion about CBI from the Prelims point of view. CBI is a non-statutory and a non-constitutional body established to investigate corruption and serious crimes. First, we shall look into the origin of CBI. The origin of CBI can be traced back to World War II. During the war, Government of India set a special police establishment to investigate corruption in the war and the supply department. Later, in 1946, Delhi Special Police Act transferred the function of special police establishment to the Home Department. Later, in 1963, the present Central Bureau of Investigation was actually formed through a resolution passed by Home Ministry. Now, the CBI is working under Ministry of Personnel, Public Grievances and Pension. Now, we shall see about the composition of CBI in brief. The composition of CBI is the director appointed by the 3-member committee consisting of Prime Minister, Opposition Leader and Chief Justice of India, and the appointment is based on the Lokpal and Lokayuta Act of 2013, which actually amended the Delhi Special Police Establishment Act of 1946. In 2014, followed by the amendment to the Delhi Special Police Establishment Act, it has been recognized that if there is no opposition leader, then the leader of single largest party will be in the committee instead of the opposition leader. Moving forward, let us see about the jurisdictions of CBI. Mostly, the CBI investigates into the cases related to economic crimes committed by the officials of central government, and if that offences affects the finance of central government. But it will also take up serious cases such as murder when a state government asks or a high court or a Supreme Court directs the CBI to investigate into it. The jurisdiction of CBI can be extended only to the state when the state gives their consent. See, there are 2 types of state consents. First one is general consent. Here the CBI can investigate all the cases within the border of the state. The second one is case-specific consent. Here the CBI can investigate only that particular case. Here it is to be noted that recently many states has withdrawn the general consent, citing the misuse of central agencies for political gain. With this, we will look into the difference between CBI and NIA. National Investigation Agency was established in 2008, followed by the Mumbai terror attack. This agency investigates the terror activities and it is constituted under NIA Act of 2008. One of the major differences between CBI and NIA is that the NIA comes under Ministry of Home Affairs, whereas CBI is under Ministry of Personnel, Public Grievances and Pension. The CBI investigates mainly into the specific cases mostly related to corruption, while NIA investigates into the cases that fall under the radar of scheduled offences under NIA Act of 2008. And one more important thing to note here is the motto of CBI is industry, impartiality and integrity. The agency plays very important role in upholding constitutional values by ensuring order and restoring the truth. So with this, let us move on to our next topic for the discussion. Look at this article. Recently, the Supreme Court emphasized preventing stigmatization and discrimination against persons with disabilities, criticizing the media for perpetuating harmful stereotypes. Chief Justice Chandrachud highlighted the negative portrayal of disabilities in films, urging a shift from the outdated medical model to a social model that understands disabilities better. The judgment calls for accurate, inclusive representation in media, discouraged derogatory terms, and recommended involving persons with disabilities in decision-making process. With this backdrop, let us see Rights of People with Disabilities Act in India 2016. Let's first look at the reservation provisions. The Rights of People with Disabilities Act 2016 ensures various rights and benefits for the people with disability. One of the significant provision is the reservation in the government jobs and educational institution. The Act mandates a 4% reservation in government jobs for physically disabled, extended to specific categories of disabilities. Additionally, the Act ensures 5% reservation in higher education institutions. These provisions aim to provide accessibility and opportunities for physically disabled in India for promoting their socio-economic inclusion. Moving further, let us see the legal protections. The Act is the cornerstone of legal protection for the person with disabilities in India. It defines disability comprehensively, covering 21 types of disabilities including physical, intellectual, mental, and multiple disabilities. The Act mandates that both public and private sectors must comply with the accessibility norms and provide for the creation of special courts for the trial of offences against persons with disabilities. It also establishes the office of the Chief Commissioner of Persons with Disabilities and State Commissioners, tasked with safeguarding the rights and addressing grievances. Moving further, let us see some data on disabled people in India. As of 2011 census, India has around 26.8 million physically disabled people, constituting around 2.21% of the total population. The data reveals that a significant proportion of physically disabled reside in rural areas with mobility, hearing, and visual impairments being the most common types of disabilities. The census data highlights the need for targeted interventions and robust policy measures to enhance the quality of life for the physically disabled people in India. Let's now see about some legal judgments, some landmarks in India. Several landmark judgments have strengthened the legal framework for physically disabled in India. Notably, the Supreme Court's judgment in the case of Javed Abidi versus Union of India in 1999 mandated the implementation of Section 47 of the Persons with Disability Act in 1995, ensuring job security for the disabled in public sector employment. Another significant judgment is Vikash Kumar versus Union Public Service Commission 2021, where the Supreme Court reinforced the right to reasonable accommodation of persons with disabilities in competitive examination, ensuring a level playing field. In summary, India's legislative and judicial framework for physically disabled emphasizes inclusion, accessibility, and protection, aiming to integrate physically disabled into the mainstream socio-economic fabric. Continued efforts and policy enhancements are essential to address the diverse needs for the people with disabilities effectively. With this, we have come to our end of the first section, that is newspaper discussion. Let us now move on to our second section, that is prelims practice questions. Look at this question. Consider the following statements regarding intensified Mission Indradhanush 5.0. IMI 5.0 focuses on immunizing children up to the age of 2 years. The campaign aims to eliminate measles and rubella by the year of 2023. The IMI 5.0 campaign was conducted across all districts in India for the first time. The UWin digital platform was used for routine immunization during the IMI 5.0 campaign. Which of the statements given above are correct? Option A, 1 and 2 only. Option B, 2 and 3 only. Option C, 3 and 4 only. Option D, 2, 3 and 4 only. And the correct answer is option D, 2, 3 and 4 only. This is because the statement 1 is incorrect. IMI 5.0 includes children up to age of 5 years for the first time rather than up to 2 years. And all other statements are correct. With this, let's move on to our next question. Look at this question. Consider the following statements regarding CBI. Statement 1. CBI is not a statutory and non-constitutional body. Statement 2. CBI was established through a resolution of Ministry of Home Affairs. Find the correct statement. Both statements are correct and the statement 2 is the correct explanation of statement 1. Option B. Both statements are correct but statement 2 is not the correct explanation of statement 1. Option C. Statement 1 is incorrect but statement 2 is correct. Option D. Statement 1 is correct while the statement 2 is incorrect. And the correct answer is option A. CBI was established through a resolution of Ministry of Home Affairs, so it is not a statutory and not even a constitutional body. With this, we can move on to our next question. Consider the following statements regarding coal. Statement 1. Anthracite is a high quality coal. Statement 2. Anthracite has a high calorific value. Option A. Both statements are correct and the statement 2 is the correct explanation of statement 1. Option B. Both statements are correct but statement 2 is not a correct explanation. Option C. Statement 1 is incorrect but statement 2 is correct. Option D. Statement 1 is correct while the statement 2 is incorrect. So the correct answer for this question is option A, because anthracite has high calorific value and so it is regarded as a high quality coal. That's all for today's discussion. If you like this video, please hit like, share and subscribe Shankar IAS Academy YouTube channel. Thank you.